Welcome to Carolina Psychological Health Services Security Privacy Training. Now we're going to start going into other policies. We're going to discuss Access Authorization Policy, Cell Phone Security Policy, Destruction Policy, Disclosure to Law Enforcement Policy, Disclosure to Family Member Policy, Electronic Signature Policy, and Email Policy. Access Authorization Policy. Our duty to protect the confidentiality and the integrity of confidential medical information as required by law and professional ethics requirements. Certain personnel are authorized access to individual identified health information and to the system components that contain such data. All personnel at CPHS must comply with this policy. Be familiar with this policy and demonstrate competence in the requirements of this policy are an important part of our everyday employment responsibilities. Cell phone security policy. This policy about cellular phones usage applies to any device that makes or receives phone calls, leaves messages, sends text messages, connects to the internet, or downloads and allows for the reading and responding to emails, whether the device is supplied by CPHS or personally owned. You may not use your cell phones or similar devices to receive or place calls, receive or send text messages, surf the internet, check phone messages, or receive the response to email during work hours unless it's in a designated area. Cell phones can provide an open door access to patient health information, allowing the other person privacy information. Remember, a HIPAA violation can be yours if you leak out patient information by use of cell phone. Now, destruction policy. CPHS, its officers, employees, and agents must destroy data that is no longer necessary to retain in the regular course of business. CPHS, its officers and employees and agents must not destroy data that is involved in audits, investigations, and litigations. So CPHS employees and agents must destroy data as follows. Paper records must be shredded. CPHS uses a commercial destruction service. Any change must be approved by the Privacy Security Officer. Magnetic media must be degaussed or erased by overwriting and purging using an approved program. The Privacy Security Officer must approve the method of destruction. Computers or hard drives must be degaussed upon disposal. CPHS will keep destruction records for not less than 6 years. The Privacy Security Officer will ensure that selected destruction services have signed business associate contracts before providing destruction service. Disclosure to law enforcement policies and procedures. CPHS protects PHI in accordance with HIPAA and its implementing regulations. CPHS cooperates fully with reasonable requests from any government agency and law enforcement for any form of PHI to the extent that the state and federal laws require and allow, including requests to provide documentations and witnesses requested by a government investigator in accordance with legal valid processes. CPHS preserves evidence in potential and ongoing investigations, administrative proceedings, litigations, and does not commit spoilage of evidence. All personnel of CPHS must follow the proper CPHS procedures in responding to law enforcement requests for PHI. Disclosure to family member policy. CPHS will inform patients of CPHS's ability to disclose such information to family members and close personal friends who are involved in the patient's care, unless the patient objects or another state or federal law giving more privacy protection requires a signed consent or authorization. During the intake or other events during which the patients provide a copy of the CPHS Notice of Privacy Practices, the workforce members will ask the patient to complete the Access of Information form, identifying who the CPHS may share PHI that is relevant in the individual's involvement with the patient's care. The workforce members is responsible for documenting the objection or lack thereof to the list of family members and friends that the PHI may be disclosed to in the appropriate location. The disclosure to family members is limited to only that PHI that is relevant to that involvement in the care. It does not authorize the family members or friends to have access to entire medical records or other documents estate, or the next of kin if estate law so permits. Note that these disclosures are permissive, not mandatory. If because the workforce members know of family dynamics that would make the disclosure problematic, the workforce members should not make the disclosure even if the patient has not objected. When in doubt, don't make the disclosure but refer the matter to the Privacy Security Officer. Electronic signature policy. This electronic signature policy is based on the following assumptions. The Medical Records Committee of CPHS has approved the use of electronic signature to authenticate the entries in medical records. Such electronic signatures are in accordance with federal and state laws. The use of electronic signatures are part of CPHS' overall security program. Misuse of this process, as by sharing passwords and/or signature keys, pose significant risk to the integrity and confidentiality of patients and other confidential information. CPHS encourages the business use of emails to increase productivity. The email system and all messages generated by and handled by email, including backup copies, are part of the business equipment of CPHS, are owned by CPHS, and are not the property of users of the system. Consequently, email users do not have a right to privacy in their use of the workplace computer system or its email components. CPHS reserves the right to monitor, audit, delete, and read email messages. The network administrator may override users' passwords. Although it is the policy of CPHS not to regularly monitor the contents of email communications, it may monitor the contents and usage to support operations, maintenance, auditing, security, and investigative activities. Users should use emails with knowledge that CPHS may from time to time examine the contents of the email communication. Nor can CPHS guarantee the email messages will be private. Email communications can be forwarded, intercepted, printed, and stored by others. Use of email system constitutes consent to this policy. Generally, email users should restrict their use of the email system to proper business purposes relating to the care and treatment of patients and related to administrative matters such as billing. A user may, however, use email for personal purposes such as communicating a change in work schedule to a significant other under the following conditions. Personal use does not involve significant use of the facility's resources such as work time, computer time, costs, and the likes, and does not exempt any business activity or interference with the users or other productivities. Users must not transmit confidential or proprietary information to unauthorized recipients. Users must not transmit obscene, offensive, harassing, or hostile messages to any recipient. No person shall enter, transmit, or maintain messages with derogatory or inflammatory remarks about individual race, age, disability, religion, national origin, physical attributes, sexual preferences, or health conditions. No person shall enter, maintain, or transmit any abusive, profane, or offensive language. Transmissions must not involve any illegal or unethical activities. Transmissions must not involve or disclose any activities that could adversely affect CPHS, its officers, employees, or agents. Transmissions does not involve solicitations. Employees may not use CPHS email system to solicit for outside business ventures, organizational campaigns, or politics or religious causes. The email system must employ user's ID and associate passwords to isolate the communications of different users. Users must never share passwords or reveal them to anyone else. If users must share data, they must use a message forwarding facility, public directories, or on local area network servers and other authorized information sharing mechanisms. Employees may not intercept or disclose or assist in intercepting and disclosing email communications. Because some information is intended for specific individuals and may not be appropriate for general distribution, users should exercise caution when forwarding messages. Users must not forward sensitive information, including patients' information, to any party outside the CPHS system without the prior approval of the department manager. Senders may not engage in blanket forwarding of messages to parties outside the CPHS system unless the sender has obtained the prior permission of the department manager. Users should periodically purge their business email storage area messages that are not part of patient records and that CPHS no longer needs for business purposes. After a specific period, the information services staff will delete email messages backed up in separate data storage media to free scarce storage space. CPHS will make all email messages sent or received that concerns the diagnosis or treatment of a patient as a part of their patient medical record and will treat such email messages with the same degree of confidentiality as other parts of the medical record. The medical staff will decide standards for determining whether particular emails will constitute part of the patient's medical record. Patients must consent to the use of email for confidential medical information. The Director of Health Information is responsible for developing and implementing such a consent form. All email concerning patient information will start with a confidential statement developed by the Director of Health Information. Users must immediately report violations of this policy to their department head and to the privacy officer.